us whose knowledge and resource have driven the war against HIV against to the brink of victory. Nataka kusema once more, as a country tunashukuru sana our sponsors. Our donors, we want to really thank you. We will continue working with you. Na kama vile niliomba ile siku, msitoke haraka sana mkisema we are developing country, endeleeni kusaidia sisi na we will continue utilizing your money well. Wakati tulikuwa pale nje tulikuwa tunafunzwa leo how to use a female condom. I've never gone through that class. Leo ndio nimeenda. Ile wakati nilikuwa kaka zikuwa zimekuja na ile mtu governor ametuambia maneno ngumu sana. Hiyo mtu amesema ati mama ataweka hiyo kitu angoje 15 minutes. Sasa wakati nimeangalia hiyo curriculum ya hiyo mtu nikaona iko na shida kwa sababu hiyo Mr. Condom na curriculum yake iko na shida. Nikamwambia aende hiyo curriculum improve, aweke maneno ile watu watakuwa nafanya hii 15 minutes wakingoja. Sasa wakingoja ndio hiyo curriculum yake ikae mzuri. So ndio tumekuwa kwa sababu sasa huwezi sema ati aweke alafu akaoshe vyombo. So tumekubaliana hiyo curriculum yake atengeneze ndio ikae presentable, kwa sababu sasa vile iko saa hizi anaipresent in a bad way in beats. Lazima aweke curriculum mzuri. The HIV response in Kenya has registered great success, but you admit that there are still challenges. We must work together to fill the resource gaps that exist to ensure sustainability and secure the gains made. The National Assembly is committed to providing the necessary legislative and oversight support to ensure the fight against HIV and AIDS remains on the right trajectory. Do not shy away from seeking our support on this journey. Distinguished ladies and gentlemen, on behalf of my colleagues, when I was here, I was with my colleagues. Na si ati wameenda. PS had organized another meeting with the Parliamentary Committee on Health, which has started today this morning. Ndio maana tumetelewa kidogo na PS tumetoka kufungua hiyo mkutano. So the members of parliament are there, and those sagas from the Department of Public Health. Na hata tukitoka hapo tunaenda kuendelea na hiyo mkutano. So all my colleagues give their assurance that we continue supporting this journey. Mahali mnataka tuwasaidie. I thank the organizers of this conference for inviting us to be part of this team of incredible professionals and scientists. Mimi sina mengi ya kusema leo. Ile kitu nitasema ni Bwana Rukali from the ministry. Some of these activities, until you come and be part of them and see what is being done, utakaa kwa bunge ukipelekewa makaratasi unasema hii pesa yote imekuliwa. Lakini when you go out na uone ile kazi imefanyika na the impact of what is happening, hata Maisha akikuja kwa kamati sasa kuleta budget na kupresent, at least I will know what she does and I've seen what is being done. Kwa sababu nimeona ni kazi nyingi. Vile mbeleni nilikuwa na wakuisho ni pesa yote mnapeleka wapi, nimekuja kurealize kumbe hata hakuna pesa tumeweka. Ndio tunatakikana kuprovide pesa sasa. So we'll continue supporting you. We take 2 challenges from here. One, from Nelson, that as a government we need now to start putting more budget for the drugs. That's a challenge. Nelson, I will talk to the committee. We have started the budget process. So that's a challenge. 2, we've been challenged as parliament to start a caucus on pediatrics. We've been challenged. It started here with the senator. Imekuja tena leo. Na kumbe that a challenge I take very positively. Issues to do with children and health are very close to my heart. So you can even go assured that will happen. Last year, I lost my daughter to cancer, 10 years old, in November last year. So matters children and health are very close to my heart. So the caucus on pediatrics is a challenge we take, and I take it very positively. Mimi nataka kumalizia hapo nikishukuru Governor Wanga nilikukuta bunge, and I know you are a powerful voice. So I know with you here at the Council of Governors, you people have a very powerful voice with the name of Governor Gladys Wanga. in parliament, wakati unasema kitu itafanyika hivi, ulikuwa unapigana mpaka inaenda hiyo njia, na hata kama itafanyika tutajua stand ya Wanga ilikuwa gani. Najua hivyo ndio inaambiangwa. So I know at the Council of Governors with you we have a serious advocate. Na tunakushukuru for even finding your time away from your busy schedule. We know being a governor is a busy schedule, and being here with us. Na governors, tunawaomba mtusaidie na watu yenu CCs wakuwe wanasaidia hii kazi, kwa sababu wakati wanakuja na tunafanya na wao, hata budget zingine watakuwa hata wanatusaidia kutuambia ongezeni pesa counties. So wacha watusaidiange kazi kidogo. Finally, Maisha, we'll continue supporting you, kwa sababu what is killing most of our institutions is leadership piecemeal. Mtu anakuja kazi leo, akijua kazi wiki mbili tunatoa tunaweka mwingine, akijua kazi tunatoa tunaweka mwingine. Hata donors wanaanza kurusi confidence na what is happening. So we need to ensure some sustainability in some of these programs. Na hiyo mengi nataka tukaribishe kwa shangwe governor wetu, Governor Gladys Wanga. Karibu sana governor.
Thank you, Asante Pato. Thank you very, very much. Our PS for Public Health and Professional Standards, Madam Mary Mudhoni, our National Assembly Vice Chairman of the Health Committee, Patrick Munene, Dr. Maisha Achola, which is the name we have given you from Homa Bay, together with the board chairman for the National Syndemic Diseases Control Council, our partners, our CCs in the room, led by your chairman, and congratulations, chairman. Kumbe yo mpango mlipanga na Pato. Congratulations, chairman, for your election. Our communities, people living with HIV who are here, our communities from various places. Good afternoon. Let me recognize my CC for Homa Bay, Roslyn Omolo, CC Health Homa Bay. I can see our County Director for Health, Dr. Komo. Anybody else from Homa Bay ambaye yuko hapa, please wave in the air. I can see there are many Homa Bay residents here. Kura ni mingi hapa. I bring you also greetings from our chair of the Health Committee for the Council of Governors. That is the governor for Tharaka Nithi, Governor Mudhomi Njuki. He sends us greetings, and really to say that I think the work that has been done here the last couple of days has been great work. Our teams have been here. We've been properly briefed, and just like Honorable Patrick was saying here, I've also been in the HIV prevention world before I left to be in Parliament. I worked with LVCT Health. I don't know whether LVCT are here. You know, you always have a free billboard, a free advertisement from me, because before I left to become woman rep for Homa Bay, I worked with LVCT for several years as HIV prevention, community coordinator, mobile VCT, even pato ile mambo ya condom demonstration, sisi ndio tulianza na Ngara. Huyo king of condoms, he used to be my staff. Sisi ndio tukapanga hiyo maneno yote. Sasa hiyo 15 minutes mimi ndio nitafanya hiyo curriculum ya kupanga hiyo kazi within that period. So it's not a strange space. It's a familiar space. We are family, we've been here. So Dr. Maisha, even as you continue this work, and that you have continued to do outstandingly, you can be sure that you have our support, not as strangers, but as people who've been part of this journey, who have walked through this process, who've seen how this has developed. So you really do have our full support. So I come here today as governor for Homa Bay, the county of endless potential, but also as vice chair of the health committee of the council of governors, and so that together we can discuss this pressing issue of ending AIDS in Kenya by the year 2030. And the challenge we face is complex, yet we must persevere in our efforts to ensure a healthy and prosperous future for our country. So first and foremost, we must acknowledge the progress we have made so far. Kenya has been at the forefront of the fight against HIV/AIDS, and our efforts have achieved remarkable success. And moving forward, we must continue to adopt a multifaceted approach where governments, and here I must say governments, both national and county governments, working together, hand in hand. Health is a devolved function, and we are very protective about health as a devolved function. As governors, CC, we are very protective because we don't want to claw back on the gains that we have made as far as devolution of health is concerned. So when we raise our voices sometimes, it's because we want everybody to continue to acknowledge health as the devolved function that it is. But the Constitution is very clear about how the national and the county governments function, which is in independent but interdependent manners. And one of the areas that we must collaborate in and work hand in hand in this fight to end HIV. And that is why we are saying that we are ready, to walk this journey together. And we've already, had discussions with our CCs ourselves, and we have said, whatever it is that is between the counties and syndemic, or whatever it is that we are saying, let us not resolve it in any other manner. Tukae chini, tuongee, because we are all working for the people. Our whole purpose is to serve the people of this country in our various counties. So whatever it is, wacha tukae pamoja, tuzungumze, we agree, and we move forward in service for the people of Kenya. So governments, our CSOs, our development partners, the private sector, our communities, making sure that we never leave behind the voices of our communities. This is about the people, for the people, by the people. And in Homa Bay, we say we are people-centered, and I'm sure in all our counties, it is about the people. And if it is not about the people, then we don't want to be part of it. And that is why I am very, very happy, Maisha, that you're carrying the communities along. You're getting their voices heard. Since we sat here, you didn't just come here and you want us to just hear your voice, and you tell us ABCD. We have heard from Dorothy, launching her book, and she's been given this platform and this space, and congratulations. And you're my constituent, so we are very proud of you. And thank you for giving her that platform to make that launch and having the voices of the people heard. In Homa Bay, we are perhaps, one of the counties that have higher burden, but we're also one of the counties that has made some of the greatest strides in this fight against HIV. We have pushed to change the face and to change the narrative. So I'd like to also just introduce to you Homa Bay's Triple Threat Initiative. And we have come together and with your support, Maisha and LVCT Health and EGPAF, we have come together as women leaders, because Homa Bay is another county again that we have elected many women leaders. We have, out of 8 constituencies, 3 women elected as MPs. We have many women MCAs. We have a woman governor. And we said this effort must start from somewhere. So we have built a caucus, a strong caucus, in an effort to end the triple threat. And it's a reality in Homa Bay, and you're welcome to come to Homa Bay. I think it is on 8th of next month when we will be launching the Kenya Plan to End AIDS in Children. By 2027, launching the RRI. When you walk into any facility in Homa Bay, and I go to many facilities all the time, there is no day. I don't know whether you see it anywhere else, but Every facility I walk into, there is no day that I don't find a child delivering in our facilities. So you will always find a 16-year-old or a 13-year-old or a 15-year-old. So when you talk about teenage pregnancies, for us it's not just a number. It is a serious issue that we must deal with. So our initiative aims at reducing the 3 threats. Na mambo ni matatu, lakini mimi ile ya kwenda binguni ndio sikubaliani nayo. Sijui watu watafuata njia gani pato wakienda binguni. Hiyo siko. Ile watu kwenda jela sawa. Watu kutoroka Kenya sawa. Lakini waende binguni. So the triple threat. So we have a goal to reduce the triple threats by 75% by the year 2027. And we are going to do this through mobilizing our political leaders, implementing catalytic interventions, utilizing a multi-sectoral approach, investing in research, monitoring and evaluation for learning and accountability, and resource mobilization. So we intend to put this caucus and reach out to every other stakeholder. And our chair, Ombati, spoke about the boy child. We also intend to bring the men into the room, and walk this journey of ending the triple threat together. So as Vice Chair of the Health Committee in the Council of Governors, I've accepted the role of champion of triple threat elimination. And in this capacity, I will galvanize the support of my fellow leaders in achieving the end of AIDS by 2030. We have the knowledge, resources, determination to achieve this goal. Now we commit to leadership, which has been there, but is also required at all times to complete this equation. Let us work hand in hand, united in our efforts to create a future where HIV/AIDS is no longer a threat to our nation. And on behalf of the Council of Governors and all governors, we give our commitment to walk this journey together with all of us. Asanteni sana, and let me now take this opportunity to welcome our PS for Public Health and Professional Standards, Madam Mary Modhoni, with whom we have now been meeting at many fora, and it appears, makofi tafadhali, PS akikuja, to speak to us. Asanteni sana. Welcome, PS. Asante. I think that's you.
Before I say anything, maybe we can please stand up, take a moment of silence for the more than 2 million lives lost to HIV-related illnesses in Kenya. Please take your seats. Her Excellency, Madam Governor Gladys Wanga, the Deputy Chair, Parliamentary Committee on Health of the National Assembly, Honorable Patrick Monene, the Chairperson, National Syndemic Diseases Control Council, Mr. Geoffrey Gitu, and other board members, the CEO, National Syndemic Diseases Control Council, Dr. Ruth Maisha, and all other officials from the Ministry of Health, county executive members of health led by Daktari Ombati Timothy, and other county officials present, our partners, PEPFAR, MAX, and other different communities, distinguished guests, good afternoon. Good afternoon. You know, when you're told to speak after politicians, you barely have words. Utaanza kusema mambo ni matatu, alafu unasahau yote. Sasa mimi sijui nitaanzia wapi. Ukiongea after Pato, and then Madam Gladys. But all said and done, I think yetu pia ni tatu kwa ministry. Na ni ile mzuri. Protect, promote, and prevent. Hiyo tu. Now, Honorable Pato, if that is a campaign, we will start it here by protecting ourselves, by your kitu, promoting, educate, 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 and prevent. If you have to abstain, then let's do it. It is with great pleasure that I join you today to draw the curtains on this enriching Maisha conference. I promise you, I will not miss another. I will keep coming. Because those practicals that I have seen out there, I will need to see them. And just like somebody said, that we kept being told, you need to be taught about sex education. But who teaches you? During our time, you simply were told, don't get pregnant and don't get diseases. But how to? Nobody told you. Nobody taught you. So I am informed that for the past 2 days, we have had nothing short of inspiring, thought-provoking, and truly insightful. And on behalf of the Ministry of Health, I extend our heartfelt gratitude to each one of you and every one of you for contributing to the success of this conference. I take this opportunity particularly to equally thank our international distinguished speakers from Zimbabwe, the Ministry of Health, Nigeria, for generously sharing your expertise, experiences, and fresh insights. Your contributions have been invaluable in stimulating conversations that will undoubtedly continue long after the doors of this conference hall close. Ladies and gentlemen, the HIV response in Kenya is a great example of how multiple sectors working together can be effective. The core principles of a single coordinating authority, a harmonized country strategy, and a comprehensive national monitoring and evaluation framework have synergistically fostered unwavering dedication and collaborative accountability. This response is truly impressive and shows how other important health issues can also be tackled successfully. During this conference, you have demonstrated the positive trajectory in our efforts to address the HIV epidemic, notably the reduction of new HIV infections by 78% in the last 10 years, and many lives saved due to expanded access to antiretroviral treatment. Clap for yourselves. While celebrating these achievements, it is important our true joy lies in witnessing people living with HIV live long and healthy lives. We acknowledge the collective efforts that have brought us here. The government is committed to attaining universal health coverage, and truly speaking, there have been activities that we have seen in the recent past to simply just ensure we are covering everybody in all corners. And to attain UHC, we have seen an expanded healthcare infrastructure. And Her Excellency here can attest that we are very keen to know who has what, which healthcare has which type of infrastructure, and also providing the health insurance that is affordable to all. Just the other day, you have seen the cabinet has approved the social health bill, which is going to be taken to Parliament. And this is an equalizer to just ensure that everybody has access to healthcare in this country. And of course, promoting preventive care to reduce the cost of quality of care. Just the other day, we have just concluded a very rigorous exercise on assessing the healthcare facilities. We want to know the gaps that are there across the country. For instance, we want to know how many dispensaries are even in your local place. Do they have doctors? Do you have the specialized care that is required to be there? And because His Excellency is going to be launching the 100,000 community health promoters that work in tandem, hand in hand with the county government, it will be very easy that these community health promoters know exactly where to direct people. The referral system should be working in this country. That wherever my mother is, if she has a flu, and probably it is something that the community health worker may not manage, then they are able to direct her, go to the nearest level 2 hospital. So we do not want to have health facilities that are rated to be level 4, but the quality of care is that of level 1. Therefore, we have assessed all the health facilities in the country, and we will be giving the report very soon to know exactly how many facilities are there, what are the gaps in human resources, what are the gaps in infrastructure, and equally, what is it that is required for them to move to the next level. And of course, we are very keen on digitization. We do not want the way that things have been happening before. When you come from one health facility and you move to another, you have to start your story from A, and you're going to Z. Therefore, we would want the facilities interlinked in such a way that if you are from one area and probably you are late, you're in Mombasa today, and your records are in Nairobi, the doctor in Mombasa can be able to read the history of your disease, and you can be able to be taken care of the best way possible. So ladies and gentlemen, the concerns voiced in this conference regarding the HIV status among adolescents, na hata hiyo nimesikia, maneno ni matatu. And they have said very keenly that there are things, one, end AIDS among children, reduce the burden of TB among people living with HIV, and increase domestic financing. Those are the 3 things that I had. Therefore, the concerns that are voiced today in this conference regarding the HIV status among adolescents and young people will continue to be our foremost concern going forward. The variety of viewpoints shared would expand our horizons, inspiring us to explore, innovate, and uncover new approaches to tackle the challenges. I applaud the collaborative efforts of the National Syndemic Diseases Control Council, the National Council for Population and Development, and the Ministry of Interior and Government Coordination. They have united various sectors to combat the intertwined issues of new HIV infections, adolescent pregnancies, and gender-based violence. We must demonstrate how our domestically crafted solutions stand ready to address complex challenges through comprehensive interventions. As we bid farewell to this gathering, I urge each one of you to take the inspiration gained from the interactions and translate into actions. I always say it is time that we moved the many decisions that we discuss in these meetings into actions. Take the decisions that have been made on the table into action. Thank you once again for your active participation. I look forward to the positive impact that will undoubtedly emerge from the seeds we've planted here. I take this opportunity to wish everyone a safe travel, and I declare this conference closed. Thank you.
I invite you, ladies and gentlemen, because after the chief guest has spoken, we don't speak no more. But I just invite you to remember the good old times of the Nyayo collapse, so that we can give a befitting appreciation for joining us together with the other dignitaries, and also for our brother P.S. Ari Kimtai who had joined us earlier. Moja, Billy, Funga, Fungua. I can see some smiles of the people who were there at that time. It tells me your age. Thank you very much. And now I kindly request that we may all be upstanding for the national anthem. East African anthem, first answer. Thank you very much. Sheikh Yusuf Nasur Abu Hamza, kindly come and lead us in the closing prayer.
Tuombe. Bismillahirrahmanirrahim. Kwa jina la Mwenyezi Mungu mwingi wa rehema na mwenye rehema. Mwenyezi Mungu, tunakushukuru kwa siku zote ambazo tumekuwa hapa. Tumekushukuru kwa subra ulotujalia. Tumekushukuru vile vile kwa yote ambayo tumezungumza. Tunakuomba Mwenyezi Mungu, yale ambayo tumesoma kwa siku zote ambayo tumekuwa hapa, utujalie yawe ni yale ambayo yatatusaidia katika kufanikisha, kupunguza, kupambana na kuwasaidia wenzetu walioathirika. Tunakuomba Mwenyezi Mungu kuwa katika yale yote tumetimiza kama malengo katika siku hizi tatu, tunaomba yawe ni yale ambayo yatatusaidia katika kujenga kielelezo cha siku zijazo. Na katika yote ambayo hatukuyatimiza, Mwenyezi Mungu tunakuomba utujalie kwamba tuweze kuyatimiza kwa siku ambazo zitakuja. Tunakuomba Mwenyezi Mungu kwamba utukutanishe baada ya miaka miwili tukiwa salama, tukiwa sote na afya, tukiwa na furaha kama tulivyokuwa hapa. Tunakuomba Mwenyezi Mungu ya kwamba ikiwa kuna mapungufu ambayo yametokea katika wote ambao wamesaidia kutuleta hapa, katika mapungufu ya kibinadamu, tunakuomba Mwenyezi Mungu uwasamehe na uturekebishe wakati ambapo sisi tutakuwa tumekosea. Mwenyezi Mungu, kwa yale ambayo vile vile tumefaulu, tunakuomba jitihada zote hizo uweze kuzilipa kwa wema. Na viongozi wetu wote ambao wameungana na sisi, Mwenyezi Mungu, kutoka sehemu mbalimbali, kutoka kaunti mbalimbali za nchi hii, Mwenyezi Mungu uwajalie busara, uwajalie hikma na uwape nuru na uwape mwongozo ili wawe ni viongozi na kielelezo chema kwa jamii zetu. Tunakuomba Mwenyezi Mungu ya kwamba katika yote ambayo tumeyafanya, katika yote ambayo tumeyazungumza na katika yote ambayo tumeyatekeleza, yawe yatawanufaisha ndugu zetu wengi walio nje ambao wameathirika, ambao wanatutegemea sisi katika mafanikio ya yale ambayo tumeyafanya. Ewe Mwenyezi Mungu, usijalie kwamba siku hizi tulizokuwa hapa ziwe bure, bali ujalie kwamba ziwe ni siku ambayo itasaidia kuleta mafanikio si kwetu tu bali kwa nchi nzima. Wote ambao wanasafiri, Mwenyezi Mungu, kutoka makwao sehemu mbalimbali, uwapeleke salama, warudishe makwao salama. Wote ambao wametatizika kiafya, wametatizika kwa njia moja nyingine, waondolee matatizo. Kila ambalo limekuwa gumu hapa wakati tumekuwa, Mwenyezi Mungu utatufanyia rahisi katika siku zijazo. Kila ambalo halikuwezekana utaliwezesha katika siku nyingine. Kwa kila ambacho kimekuwa mbali utakileta karibu. Mwenyezi Mungu, tunakuomba kwa sababu hakuna mwingine wa kuomba ila wewe. Ndiye muumba, ndiye mweza na ndiye mjaliwa wa kila kitu. Wa sallallahu ala sayyidina Muhammadin nabiyil ummi wa ala alihi wa sahbihi wasallam. Amin.
Thank you very much, ladies and gentlemen. Lunch is served. Bon appetit. See you.
Thank you. I will request the protocol team kindly to exit our VIPs. Let's allow them to be the first, kindly. Protocol team, haraka haraka tafadhali, mheshimiwa wanapotoka.